One of the endoscopic procedures I do for hand surgery is actually an endoscopic carpal tunnel release. And typically people with carpal tunnel, they get numbness and tingling in their thumb, index, long finger, and can have part of the radial part of their ring finger as well. They typically complain of dropping things, numbness and tingling at night, when they're typing, when they're doing gripping or grasping activities. What tends to bring them in here the most is when they just can't sleep at night because of the symptoms. In somebody that has failed conservative measures such as injections, night splinting, or even day splinting, we can advance to an endoscopic carpal tunnel release. And the advantage of the endoscopic carpal tunnel release is it's much less invasive than an open procedure. An open procedure incision is typically an incision that goes about from the first web space in line with the ring finger, anywhere from an incision that goes part way down the palm to an incision that goes all the way down to the distal wrist crease. So you got quite an incision where you're going through skin, soft tissue, fascia, down to the transverse carpal ligament. And with this type of incision, you're causing more trauma than you would with an actual endoscopic procedure. When I'm doing an endoscopic carpal tunnel release, we're using this same incision as a landmark as far as what our approach is, and typically I'll mark out that incision before doing an endoscopic procedure because I use it as to direct where my endoscope is going. But your incision for an endoscopic carpal tunnel release is typically about like that. The nice thing about doing your incision here is your median nerve is much closer to the surface than it is here. Here I've got to go through a number of tissue planes to get to it. Here I'm making an incision through the skin, moving the palmaris longus tendon to one side or the other if they have it, and it takes me right down onto the fascia, and then right under the fascia are the flexor tendons in the nerve. So after making an incision like this, what I am doing, and this is all done under local anesthesia with a little bit of sedation, and it can even be done in some people under just straight local anesthesia. But after making this incision here, I'm going in with one of two devices. This is the one that typically I'm using now, which is just a little scope. There's a camera that fits back here, allows me to visualize this port, and then when I actually elevate, push this button down, it elevates up a blade, which we've removed. But from this incision, I elevate the soft tissue off that ligament, which sits deep to here, going from about here to here, and I actually place this underneath that transverse carpal ligament. As I'm visualizing the undersurface of the transverse carpal ligament to make sure there's no nerves, tendons, or anything else in the way, I then elevate the knife, gently pulling back. As I pull back on the blade, I can actually see the release of the transverse carpal ligament, release all the way back to the beginning of the transverse carpal ligament. I then take the endoscopic blade out, and I actually take a little dilator and dilate up that incision that's deep to the skin even further, and then using small scissors actually released up to about here. A small percentage of patients actually have tightness around their median nerve starting up into their proximal or their distal forearm as well. So that's allowed me to release the ligament, leave the integrity of the soft tissue in place, minimal incision, and you're actually using your hand right after the procedure. So we put a little bandage over it, get you moving your hand right away. So it's a very nice treatment for which is minimally invasive, less pain, quicker mobility than what a standard open procedure is.